Hi, today I would like to welcome Mary Wilson Trider, President and CEO of the Almonte General Hospital and the Carleton District Memorial Hospital. Welcome, Mary.
Thank you.
Thank you for offering to participate in our video today. I believe it's equally important to our residents to not only hear your voice, but also to see the face behind the words. To start off, I would like to ask you, Mary, if you could qualify and clarify the difference between your role and that of Dr. Paula Stewart from our health unit.
Happy to. So as the CEO of the Carleton Place and District Memorial Hospital, my job is to make sure that we have a hospital in the community to serve the residents, that we have enough staff, that we have enough physicians, that we are following all of the appropriate practices and protocols in our care and treatment of patients who come to us from the community. Dr. Stewart has a much bigger job than I do. Her job is to look across the spectrum of things that may be coming at us, whether it's this pandemic or influenza or any of the other things that affect communities, to understand how a disease moves, how it progresses, what the trajectory is, and how it's impacting the communities. Her job is also to help us and guide us and give us direction on things like use of personal protective equipment, appropriate use of medications, appropriate infection prevention control practices. And so we look to her very much for her guidance and her wisdom as we deal with something like the coronavirus on the ground.
Good to know. Thank you. Can you give us an update on our hospital in context of the existing pandemic, Mary?
Certainly. So it's interesting in the hospital right now because we have, on one hand, been gearing up our activity to be prepared for the virus and to make sure we're putting the right kinds of processes and procedures in place. On the other hand, some of our activity is actually tapered off. So very early on, we made the difficult decision to cancel elective surgery and to ramp down most of our ambulatory care clinics in order to keep people out of the hospital, to make sure that they were staying safe. So some of our folks are very quiet right now in terms of the things that they would normally do in their day jobs. Okay. We also, although they are doing other things in the hospital, we also have a number of staff who are now working from home. So for example, our human resources staff, most of our health records staff, some of our administrative staff are working from home.
Makes sense.
Yeah. We've also made some physical changes in the inside and the outside of the hospital for the purpose of screening. You'll see a new structure outside the front of the hospital that people approach when they want to come into the building to be screened by a nurse to determine whether they have symptoms or don't have symptoms of COVID, and then they either come in the front door or they go up into the ambulance bay. We've also made some physical changes inside to increase our negative pressure rooms for treating people when we have to do things that generate aerosol. And also we've hung up some plastic curtains again to try to isolate and protect people from the areas where we might have things happening that could for a period of time result in the disease being spread.
Okay, sounds proactive.
Yeah.
Can you give us an update on the assessment center in Almonte, how it's doing and how your resources are being allocated, etc.?
Yeah. Yes, absolutely. So I was delighted when the physicians in Carleton Place and the physicians in Almonte came together to talk about what made the best sense in terms of having an assessment center to serve the communities, and really looked hard at what was the best use of our scarce human resources, and also what was the best use of our scarce personal protective equipment. There's a lot of conversation, there's a lot of coverage in the media about PPE, as we call it, masks and gowns and so on. And we're all working really hard to make sure that we're not using any more of that than we absolutely have to. So as they looked at scarce human resources, looked at making best use of PPE, looked at where we could easily and quickly set up an assessment center, they together decided that the empty ambulance bay behind the Almonte Hospital made the most sense as a location. And so Dr. Steve Walker and Dr. Karen Turcott took the lead on getting that up and running. It opened on the 31st of March and has been a collaboration not just between the medical staff groups, but also the Lanark County paramedics and also our public health unit.
Okay.
So it's staffed by a paramedic, a nurse, and a physician. As I say, it's been open for about 3 weeks. We've seen about 280 people in total in that 3-week period. Yeah.
Okay.
Yeah.
All right, that's good to know. Forgotten throughout the duration of this pandemic is our excitement looking forward to our new ambulatory addition and renovation to the existing hospital. Can you give us an update of the impact of the pandemic on those plans?
The interesting thing about the pandemic in the emergency department is there is actually a silver lining. So we submitted our stage 3.1 documents to the ministry just before Christmas, and several weeks ago received back from the ministry a list of questions about that submission. And truth be told, our staff who would ordinarily be spending all of their energy on that have been busy with things related to the coronavirus. So there is going to be a bit of a delay in our ability to get those questions answered. We also have a restriction right now, of course, because we can't have meetings with lots of people poring over single documents. So again, a bit of a delay in getting our response back to the ministry. The silver lining, though, is that we are learning so much right now through going through this process about what we need, want, and should have in our new emergency department to make sure that if something like this ever happens in the community again, we are very well prepared. So we're taking lots of notes of all the lessons that we're learning, and as soon as we can get back to those documents and back to that planning, we're going to apply all of this learning to the design that we've already got and say, okay, based on what we've learned, what should we or could we be doing differently in our new emergency department? If we'd already been at the point where construction had started, it would be too late. So this is, although nobody wants a pandemic, in terms of the planning of our new emergency department, the timing of this is actually a bit of a gift.
So there's a drop of good news there.
There is a silver lining in our cloud, yes.
Not last but least, I would like to talk about staff. You know, we often lament the lack of role models in today's society. And if there's one positive from the pandemic, it has to be the dedication of all the professional staff and physicians during this pandemic. It's really been very remarkable, humbling. And if you could share with your staff and physicians the appreciation of all the residents of Carleton Place to their efforts, I think it would be greatly recognized.
Thank you very much. I appreciate that, and I absolutely will share that. You know, when the going gets tough, you really find out what people are made of, and I cannot tell you how proud I am of everybody on the staff and the medical staff at the Carleton Place Hospital. They have risen to the challenge. They've been flexible. They've been adaptable. They've been working in new ways. Some of them are wearing masks all day long, which is not a very comfortable thing to have to do. Some of them have loved ones and others at home that they're worried about and who need care, and yet they still come to work. Others have flexed themselves so that they can work at home. And throughout all of this, their focus has been on making sure that our patients are very safe and very well cared for, and I am so, so proud of them. So thank you. I will definitely pass on good wishes from the community. I'm
known to be a little emotional, and so I'll leave it at that, and thank you for listening. And once again, for all those who shared our last one, if you could share this video, would go a long way in once again educating and sharing that the community is working together in cooperation, and a fine example of the professionalism of Mary here today. So thank you all. Thank you again for inviting me. Okay.